action.
Okay. Hey guys, so we are here to talk about our Zoll defibrillator. We're going to go through the steps on how to check off your Zoll and make sure you feel comfortable with it. If at any point you want to meet Dave Butler, myself, there's several of us that would be happy to go through this checklist with you in person. I also want y'all to know that we have these sheets, which will have everyone fill out for us. I'll make sure you have a copy for Skills Fair, but we have these sheets if you ever need a reference on our computer, on the desktop in our workroom. I can show you where to find them. Okay, so we're gonna do a virtual Zoll checkoff here. What you're gonna do is you're gonna come to the Zoll. You're gonna look here to start with. It says assess for the green check or the red X in the window. You see you have a green check mark right here. If you were to see an X, per Dave Butler, one of the first things we should do is make sure that we are plugged in. You can always try to unplug it, plug it back in to do your test. And then if for some reason your X mark persists, then that's when we might need to reach out to Biomed to see what's going on with the defibrillator. The next thing it says is we're going to demonstrate a 30 joule defibrillator test. So in order to do that, you're going to make sure that you unplug your defibrillator here, and it actually, your Zoll plugs into itself here on the side to do your test. Okay, so we are going to turn on the defibrillator. It wants a 30 joule test. It defaults to 120. We're going to drop our joules to 30. Okay, then we are going to charge and we're going to shock. And you see it says 30 joule test was okay. You see it's printing paper up here for our test. That's the next thing we need to look for. This is where your paper for your defibrillator lives, right here. You can open it up to make sure that you have plenty of paper. If you were to need more paper for the Zoll, it usually lives in this very top drawer of your crash cart. All right, moving down our list, it talks about the monitor mode of your Zoll defibrillator. So it wants to make sure that you can apply 3-lead EKG and select the monitor mode, which is this gray mode right here. We're all familiar with how to apply 3-lead EKGs. It then wants you to make sure you know how to change the leads. That's this button right here. And in your window, you can see right here, you got P1, P2, P3. That's how you're going to change the lead or go straight to your pads. That's how you change the lead on the defibrillator. If you wanted to print a strip, you're going to hit record here and it's going to print up here with your paper. And then turning on and off alarms. If you want it to silence, you're going to hit alarm suspend right here. All right, so moving down to the pads, the next thing we're going to talk about are the two types of pads we have available. So we have the one-step pads, which is, you know, kind of the fancier pads. These are going to be where your AEDs are around the hospital. And then we also have the Pro pads, which is what you're familiar with when you go into your heart room. This is what we'll use in the heart room. So they are different in terms of the differences in these pads. You see this one right here, it has a CPR indicator. It obviously has pictures for proper pad placement. The nice thing about these are the pads that as you deliver CPR, it literally tells you push harder, push faster. These are the pads that in a second we'll show you on the Zoll. It'll tell you, you'll be able to see the window of your depth and your rate. And so that's kind of how they're a little bit fancier. Same thing with the Pro pads. It also shows you pictures of proper pad placement. And like I said, these are the ones you're familiar seeing in the operating room, like with our hearts. We already talked about the CPR sensor. And then in terms of, you know, plugging in these pads, you know, y'all are used to doing this in the heart room. You know, we do this every day. But so these are the Pro pads like you'd see in the heart room. You plug them right in to the Zoll. And then same thing for the Pro pads. They look a little bit different. Should I but they plug in like that for the Pro pads. So that's how
one
you,
step.
excuse me, for the one step. Okay, AED auto analyze mode. So for this part of it, you're just gonna turn it on, go to the defibrillator mode. You're gonna tell everyone to stop CPR and stand clear. You're gonna analyze to see if a shock is necessary. If so, you'll follow the voice prompts, charge and shock if it's recommended. So for CPR feedback, like we were talking about with the one-step pads, this is the information that these pads generate. So with the one-step, it'll tell you depth in inches. It'll let you know if you need to push harder. It'll tell you your rate for beats per minute. It will let you know if you need to push faster. The other thing is it allows you to see as you deliver CPR and compress the chest, you'll fill up this box, and then as you rest to allow for recoil, it'll drop back down. So as you deliver effective CPR, it fills this diamond, and that's how it lets you know, again, if you need to push harder, push faster. While we're looking at this screen, the other thing that Dave and I, it's not on our checkoff sheet, but as you see in this top left corner, the CO2 analyzer. So as a part of our responsibility when we respond to codes, attached to your Zoll, you'll see this fun little piece that plugs in back here, the back of the Zoll, this little yellow cord here. In your respiratory drawer of your crash cart, there is an adapter piece that fits right in here into this analyzer. You'll put your adapter piece in, it then rests, it goes, it fits on your endotracheal tube. And so as you're delivering CPR, as you're giving breaths, it's gonna tell you whether or not you have end-tidal CO2. So it's another way that we can make sure that we have gas exchange, which is something that we are supposed to be doing as we respond to codes. Let's see. Here. Okay, so we talked about the proper rate and depth. So understanding see-through CPR, what that means is when we use these one-step pads, what will display here on your defibrillator, it will show you the underlying heart rhythm. It takes out all of the artifact from the CPR and shows you what the actual underlying heart rhythm is at that time, which is different from if you were using your Pro pads. Your Pro pads will not take away the artifact. It will you know, you'll have lots of artifact from your CPR. So that's another difference between the two types of pads. Verbalizes understanding and importance of voice and visual CPR prompts. I think we're all familiar with that, with running codes and ACLS training. So manual defibrillation selects defibrillator mode, which is this red mode here. Presses the charge button, it automatically defaults to 120 joules. So you'll charge, and then you'll deliver your shock, which it won't let me do because I'm hooked into the pads. But so since we're talking about this, in terms of adjusting your joules, it defaults to 120. You can increase your joules here, 150, 200, or you can decrease your joules. So if you have pediatric patients, the dose is 2 to 4 joules per kilogram. So hopefully you either know your patient's weight if they're a pediatric patient. Dave said if you don't have access to a Brazlow scale, you know, you just do your best, you guess. And we'll show you what that Brazlow scale looks like in a second when we talk about peds patients. For synchronized cardioversion, so you're going to go back to your defibrillator mode, which is red, and you're going to put the device in sync. So down here at the bottom right, you'll see the button sync on and off. You're going to hit sync, and it automatically sets you to 120 joules. Again, you can increase that or decrease that for your cardioversion. You'll tell everyone to stand clear. You'll deliver your synchronized shock. Okay. I'm gonna turn it back on.
Remove sync.
In terms of pacing, you're gonna turn your defibrillator, you're gonna turn it down here to your pacing mode. And then you see down here for your output, you can increase your output to make sure that you have capture. You can increase it or decrease it. You see right here, your milliamps, 10 milliamps, 15 milliamps down here. And then same thing, you can adjust your rate. It defaults to 70. So over here with your rate, you can increase your rate, 80, 90, whatever your desired rate is, but that's how you're gonna change those two things. And then the 4-to-1 button, what this does, it's right here. So you see right now, obviously we don't have an EKG rhythm, but it's delivering, a pace rate of 92. If you want to see what their underlying heart rhythm is, you can hit this 4-to-1 button. You have to hold it, but what it's gonna do is it's going to pace one beat and then show you the next 4 beats if there's an underlying heart rhythm, what that rhythm is. But again, you have to press and hold down the 4-to-1 button. For internal paddles, this is something that we do every day in the heart room. You're gonna hook up your internal paddles when they give it to you sterilely, right here. Again, we do every day in the heart room. You're gonna go and turn on your defibrillator. And then, I feel like typically we start at 10 joules if you're, needing to shock, if you're needing to defibrillate the heart when we're in the heart rooms with the internal paddles. So I feel like we usually start at 10. Sometimes we'll go up to 20. But again, that's how you're going to deliver your shock. You'll charge it and then shock. In terms of pediatric patients, obviously if you don't have access to peds defibrillator pads, it's okay to use the adult pads. Here are examples of our pediatric pads. Same thing. We have the one-step pediatric pads, which has that CPR indicator sensor like we talked about. And then same types of different pads. You have the PD pads, which are similar to the Pro pads for pediatric patients. So this is actually our pediatric crash cart. You see here the Braslow scale is down here on the side to help you with your different sizes. But again, if you don't know your patient's weight, you wanna estimate it. The correct joule per kilogram is 2 to 4 joules per kilogram for defibrillation. What'd I miss, Dave?
That sounds like everything.
Okay, if y'all have any questions, please feel free, reach out to myself, Dave Butler, any of the CRNAs in the department. We can bring you through and go through the check together. But we are going to have everyone fill out these sheets. I'll make sure that you have access to a copy of them, and then you'll turn them in to me when we're finished. So y'all let me know if you have any questions. Thanks, everyone.